Assalamualaikum warahmatullahi wabarakatuh to my beloved lecturer, Dr. Zulkarnain. My name is Muhammad Shafiq Aika bin Osman, along with Muhammad Anwar bin Rizwan and Siti Masyara binti Ahmad. Today, we will present about special tests on elbow injury. So, the first one is lateral epicondylitis. Lateral epicondylitis, or commonly known as tennis elbow, is caused by swelling of the tendon that bend your wrist backward away from your palm. Tendons are strong tissue cords that link muscles to bones. The extensor carpi radialis brevis is the tendon that is most likely implicated in tennis elbow. So, tennis elbow is caused by the force of the tennis racket hitting balls in the backhand position, as the name indicates. Excessive strain can cause soreness in the forearm muscles, which connect to the outside of your elbow. The tendons that roll over the end of our elbow might be harmed when we do a backhand stroke in tennis. Tennis elbow can be brought on by improper backhand stroke, weak shoulder and wrist muscles, using a tennis racket that is too tightly string or too short, other racket sports like racquetball or squash, and lastly, hitting the ball off center on the racket or hitting heavy like wet balls. For the mechanism of injuries, repeated tension to the big muscles group on the outside of the elbow and forearm is frequently the mechanism of damage. Improper technique of muscular weakness can potentially cause minor rips in these muscles. Poor tennis backhand form, repetitive use of a hammer or screwdriver, repetitive grasping, and excessive typing on a keyboard are all examples. So now I will show you how to do Cousin test for lateral epicondylitis. So to conduct the test, have your patient in a comfortable position and stabilize his elbow while you palpate his lateral epicondyle with your thumb. Then ask your patient to make a fist, pronate his forearm, and radially deviate and extend the wrist while the examiner gives resistance. This test is positive if your patient complains about sudden pain at lateral epicondyle. So that's how you do Cousin test for lateral epicondylitis. So now bear in mind on what you can do and what you cannot do during the test. So examiner need to use the correct technique to do the test. Use proper equipment and make sure the environment is good. And also make sure the patient in comfortable condition. So what you cannot do during the test is you need to make sure not to put the resistance too high on the patient. And also don't put patient hands on hard surface. So the next one is medial epicondylitis. Medial epicondylitis, sometimes known as golfer's elbow, is a tendon overload injury that results in tendinopathy. During wrist flexion and forearm pronation exercise, repeated force wrist extension and forearm supination cause flexor pronator tendon degeneration. As a result, tendon degeneration replaces tendon healing. On the medial epicondyle of the humerus, at the origin of the wrist flexors, is the most sensitive area. The patient may also have discomfort on the ulnar side of the forearm, the wrist, and the fingers on occasion. The excessive power exerted to bend the wrist towards the palm causes medial epicondylitis. When swinging a golf club or throwing a baseball, this can happen. Other factors that might include medial epicondylitis include serving with a great force in tennis or using a spin serve, weak shoulder and wrist muscles, using a too tightly strung, too short, or too heavy tennis racket, and lastly, throwing a javelin. So for medial epicondylitis test, we will do golfer elbow test. So I will show you that. So to perform this test, have your patient in a standing position. Fixate your patient's humerus and palpate the medial epicondyle at the same time. Then, passively supinate your patient's forearm, extend through patient's wrist, and extend the elbow fully. Okay, this test is positive if your patient complains about sudden pain at the medial epicondyle. So here's what you can do and what you cannot do during the special test. So what you can do, examiner need to use the correct technique to do the test. Use proper equipment and make sure the environment is good. Make sure the patient in comfortable condition. So what you cannot do during the test is you cannot extend the elbow too fast and don't touch or moving patient hands too rough.
Next, I will talk about cubital tunnel syndrome. Cubital tunnel syndrome happens when the ulnar nerve, which passes through the cubital tunnel, that is a tunnel of muscle, ligament, and bone, on the inside of the elbow, is injured and become inflamed, swollen, and irritated. Common injury at the joint. An overuse injury is defined as any injury to a muscle or joint which is caused by carrying out repetitive actions over an extended period of time. They can occur in any part of the skeletal system. Overuse is commonly associated with cubital tunnel syndrome, as this can develop as a result of repetitive pressure which is put on the muscle over time. Mechanism of injury at the joint. Cubital tunnel syndrome may happen when a person bends the elbow often, that is, when pulling, reaching, or lifting, leans on their elbow a lot, or has injury to the area. Arthritis, bone spurs, and previous fractures or dislocations of the elbow can also cause cubital tunnel syndrome. In many cases, the cause is not known yet.
Assalamualaikum, my name is Muhammad Anwar Rizwan. My metric number 2020856068 and I am from class RSR 24528. So today I'm going to conduct special test for cubital tunnel syndrome. To conduct the test, the patient should be in sitting position. Firstly, support the arm to be tested, and then using a reflex hammer, lightly tap on the ulnar nerve just proximal to the cubital tunnel 4 to 6 times. The test is positive if patient report familiar symptoms along ulnar nerve, include pains, tingling, and numbness. That's all from me. Thank you.
Next, I will talk about cubital tunnel syndrome. Cubital tunnel syndrome happens when the ulnar nerve, which passes through the cubital tunnel, that is a tunnel of muscle, ligament, and bone, on the inside of the elbow, is injured and become inflamed, swollen, and irritated. Common injury at the joint. An overuse injury is defined as any injury to a muscle or joint which is caused by carrying out repetitive actions over an extended period of time. They can occur in any part of the skeletal system. Overuse is commonly associated with cubital tunnel syndrome, as this can develop as a result of repetitive pressure which is put on the muscle over time. Mechanism of injury at the joint. Cubital tunnel syndrome may happen when a person bends the elbow often, that is, when pulling, reaching, or lifting, leans on their elbow a lot, or has injury to the area. Arthritis, bone spurs, and previous fractures or dislocations of the elbow can also cause cubital tunnel syndrome. In many cases, the cause is not known yet.
And today I'm going to conduct special test for ulnar collateral ligament injury. Firstly, to conduct the test for ulnar collateral ligament injury, the patient should be in sitting position. The arm positioned in around 70 degrees of flexion, adduction, and maximal external rotation. This position supported by the patient's other arm. Then, positioning the elbow in about 70 degrees of flexion has been identified in a cadaver study as the position of greatest valgus laxity. Next, proceed by palpating the medial joint line with your thumb and then fully supinate the patient's forearm and pull on the patient's thumb, exerting a valgus force to the elbow. A positive test will show an apprehension, instability, and medial joint pain.
Radial collateral ligament. The radial collateral ligament is a strong, short, thin band of tissue that connects from the humerus upper arm bone to the radius one of two forearm bones. The role of the RCL is to provide stability against inner to outer stress on the elbow. The most common way an individual can tear or injure is fall on an outstretched hand. Radial tunnel syndrome. The radial nerve is one of three nerves in our forearm traveling from side of our neck down the back of our arm through our forearm and into our hand. Radial nerve is responsible for a lot of different movements such as forearm rotation, elbow extension, wrist and finger movement. Mechanism of injuries. Radial collateral ligament. RCL injuries occur as a result of a forced adduction movement on the metacarpophalangeal joint MCP of the thumb, which may occur from a fall on the radial aspect of the thumb and hand during sport when a ball or a layer strike the thumb. Second one is forces twisting on the arm, fracture and dislocations. Radial tunnel syndrome. It caused by pressure on a nerve in your arm called the radial nerve. It also causes heavy lifting, extending our elbow too much, and general activities require extensive use our forearm and wrist. Special test for radial collateral ligament and radial tunnel syndrome. Radial collateral ligament. The affected elbow is placed in approximately 30 degrees of flexion with the humerus in full medial rotation while palpating the lateral joint line. The therapist then apply a varus force to the elbow. If the patient experiences pain or excessive gapping compared to the contralateral side, the test is considered positive. Radial tunnel syndrome. Turn the palm from a palm down position to a palm up position, again resistant. If feel pain in the forearm, is likely a sign of radial tunnel syndrome. The second part of this test requires to keep the middle finger straight, again resistant. It's painful to do so. It's also a sign of radial tunnel syndrome.
The patient must in standing position and then flex the elbow about 30 degrees. The other hand put proximal to the wrist joint and then apply an abduction. A positive test will result pain and laxity. Here is radial tunnel syndrome. Supination for arm and hand against resistance so that the palm face forward or upward. After that, resisted extension of middle finger. A positive test will result pain.